So I'm really excited to introduce you guys to 5 absolutely spectacular alums. You will notice in the little handouts that you have everyone's bios except for Alice, who we're missing, who came in at the last minute. We're super excited to have her. And also, you'll notice Adana, who is listed in there, has the flu, and she sends her regards and is very, very sad that she can't be with us today. But I'm sure many of you will meet her throughout the course of either your fellowship or afterwards. She's very active in the GHC community and super fabulous. So I wanted to give all of the alums a couple of minutes to introduce themselves and let you know where they were a fellow, what year, organization, country, and their job description, and then also what they're doing now. So, Tinashe, you want to lead us off?
I knew I should have changed seats. Is this a bit too loud? Okay, my name is Tinashe. I'm excited to be here. I was a fellow at Covenant House in Newark, New Jersey, a fellow 3 years ago now. Is it 2011, 2012 class? So, been out a little bit. My job description there was health fellow or health counselor, kind of depending on who you're talking to. But me and Jane, the other fellow, we worked on care coordination for our clients, helping them access healthcare services in New Jersey. Most of them didn't have health insurance, so we kind of had to navigate through the health system to help them get the care that they were supposed to get, amongst other things that we did, like health education and other work that we did in the organization. I'm originally from Zimbabwe. I trained as a physician and worked in Zimbabwe before I joined this magnificently wonderful organization, Global Health Corps. And right now I'm in St. Louis, Missouri. I just got done with my MPH, Master of Public Health degree there. And I'm excited to be here to spend time with you guys.
Hi, I'm Bryan Eustis. I briefly introduced myself before. I worked in Malawi with Partners in Health during the 2011-2012 fellowship, GHC fellowship, working on supply chain and logistics.
Would you mind standing up when you talk?
Ooh, okay.
We'll all stand up when we're talking so everyone can see.
Okay. And yeah, it's such a big class. I guess we have to do that now. After I finished my fellowship, I took a job in the Boston office as PIH's strategic operations officer, working on strengthening the operational components of our clinical programs at different sites around the world where we work. I've been doing that for the last year and 3/4, and then just now I'm serving as the interim program manager for Abwenzi Paza Moyo for our program in Malawi. Great, thanks.
I'm Liana. I was also the same year as these 3. I was at the PACT project, which no longer exists, and it was a domestic program of Partners in Health located in Dorchester, Massachusetts. We're treated essentially like a country program of the main office. And since I finished, I was doing a master's for about a year in the UK, and then came back to Boston and have since been working with a team of researchers who largely do health policy work to found and launch an initiative on global health quality. If anyone here is going to be placed at the Global Health Delivery Initiative at Harvard, we will be working together.
Hi. Is that working? Yeah? Oh. I am Genevieve. I was a fellow last year from 2012 to 2013 in Uganda. I worked with Millennium Villages Project, and I just met the new MVP fellow there. And my title when I was there was Health System Quality Improvement Coordinator. I don't know if it's still that. It's very long. And basically what I did, I worked mainly on e-health and m-health systems there, and a little bit in monitoring and evaluation. And I now live in Cambridge, Massachusetts. I work at Babson College, which is a business school outside of Boston. And I'm in a brand new initiative there that's for global healthcare entrepreneurship. I am the one and only employee. So it's been another year of kind of figuring out what my job description is, figuring out what exactly Babson wants to do in the global health sphere. So it's been a really exciting year, and I definitely feel like the year spent in Uganda has been extremely helpful in this new project in Boston.
Hi, I'm Alice. I think I'm the oldest fellow here. I was in the second class, 2010 to 2011. I was also at the Covenant House. I was a health counselor. And since then, I'm now a third-year medical student at University of Vermont, and I'm doing OB, which is applicable because I worked with a lot of pregnant women when I was at the Covenant House, which is one of my favorite parts. So it's been really special to come here. It just started about a week ago. Delivered my first baby on Wednesday, so I had some help. I had a little help, but first time they didn't just let me like stand back and watch. So I'm really excited to be here talking about my experience.
Awesome. So the hope and the intention of this panel is to both have you guys hear all of the awesome things that the alums did during their fellowship and after, but also to have like a real straightforward talk about challenges, about joys, about all of the different things that they went through throughout their fellowship. And so I have some questions specifically to get at some of those, but we want to leave most of the time open for Q&A so that you guys can ask questions, because I have a feeling you all have a lot of burning questions that these guys would be very, very well equipped to answer. So my first question for you guys, and different people will answer different questions, is if you could talk about both, either or both, an accomplishment during your fellowship year that you're really proud of, and or a challenge that you faced, and how you dealt with it. Everything was perfect. Come on, guys. We talked about this.
So one of the things that PACT did was implement a community health worker infrastructure in Dorchester and in the greater Boston area for high-need AIDS and HIV patients domestically. And one of the things that I worked on when I was there was building out a curricula that we could use to work with other public healthcare systems throughout the country to integrate community health workers into their primary care systems. And one of my favorite moments was going down to New York City, and we were working with the New York City Department of Public Health, training community health workers and community health worker supervisors on sort of how to integrate and like how to interact. And they were asking us questions about our own program. We had this beautiful dialogue back and forth in which, I don't know, it just felt like it kind of clicked. So that was a win. And they have a really robust community health worker system in New York City, which often is called health promoters. There are a couple of different names depending on the health center that you're at. And I think one of the challenges, which I expect we'll talk about a little bit more later, is my co-partner and I were coming to the fellowship from very different life places. I was one of the youngest fellows, and she was one of the oldest, had a medical degree as well as a master's, and we were given the exact same job title. And I think navigating how to figure out that division of work, who was doing what, how did we interact with our organization, was something that was definitely very challenging, but also ultimately, after a few fights, was fantastic.
Awesome.
Since Bryan doesn't want to say anything, I might as well say something. So I think for me, I always say we, because we work in pairs. So I'm not going to say I did anything, because I think Jane did an awesome job. But for us, I think one of our greatest achievement was being able to get new services. If you're from the United States or you've been here long enough, you may realize that getting things like dental care can be a challenge, or getting some of the specialty care, healthcare, it can be very difficult to get. And I think one of the things that we're able to do was to just do that, trying to connect with new providers, getting providers who would see our clients, who normally would not necessarily have seen the clients, but being able to build that rapport and create those connections. And that's something that I think me and Jane were proud of doing. and also strengthening, the relationships that already existed. Because when we got into the fellowship, Alice and the fellows that had gone before us had done a lot of great work and trying to build onto what they have done and strengthening what they had initially established. I think that was something that we were able to do, and I think our hope is that the subsequent generations kept building onto that, and that actually helps not only the clients, but also strengthens the relationship between the Global Health Core and Covenant House. So that was a great thing for us. I think a great challenge for me probably initially was trying to basically understand, coming from Zimbabwe where we don't have Medicaid, we don't have Medicare. I'm sorry, I just assumed everybody knows that. But that's health insurance, government, federal funded health insurance in the United States. But trying to navigate that and trying to figure out how does this work, and I'm from Zimbabwe, I'm like, what is all this information about? I have to explain to my clients that, oh, sorry, this cannot be covered because of 1, 2, 3 reason, when I actually don't even know what this is, And I think for me that was one of the challenges, and I think a lot of fellows, you're gonna kind of feel that, whether you're here in the United States or you're gonna be abroad, you kind of have to first sit down and say, okay, how do I overcome this challenge? Spend the time to study and understand and read and ask questions and seek counsel from different people. And I think that's kind of how I, overcame that particular challenge.
So one challenge that my co-fellow and I really experienced when we first got to MVP was that the fellows before us had a really tough year. So coming in and having them leaving and kind of glad to be leaving, and having to realize that we were just starting our year, that was really hard coming into that. And I think we did a good job of being able to learn what we could from the previous fellows and learn a little bit about why they had such a hard time. And I think that the placement has only gotten better every single year. And one thing Terry and I both really struggled with was not really having a clear job description, or a job description that didn't quite match the expectations. And I know that's another thing that Jen's gonna bring up. And so figuring out where we're actually gonna fit and being okay with not really having a lot of tasks for the first couple months that we were there, and having to figure out, all right, what is it that we're actually going to be doing? How can we be helpful? How can we really make a difference at this site? And being comfortable with the ambiguity, and being comfortable with getting to know staff, getting to know people that can be allies within the organization. And I had just I just graduated when I went to Uganda, so I was used to having very kind of precise deadlines, and you have this paper, you have this test, you have this thing, you know what's expected of you. So for me especially, I think going into this environment where the expectations weren't so clear was a really tough challenge with me. And fortunately, my co-fellow also had a similar experience, so we were able to really work together to refine our own individual job descriptions. We also had the same title, but very different background. She had worked a lot in HIV and AIDS, and I had a strong interest in e-health, so we were able to kind of build off of that, and ended up getting 2 really great job descriptions and roles out of something that started as very ambiguous and very unclear. So I definitely think work with your co-fellow as much as you can. You'll probably, even though you're going to be coming from different backgrounds and different places, you'll probably experience a lot of the same challenges when you first arrive. So don't assume that just because you're different ages or have different career backgrounds that you won't experience some of those same challenges. Because I think, at least in my experience, that was definitely the case for us.
Awesome. Am I still on? Yeah. Okay. Awesome. Do you have anything else that you wanted to add, or should we? I do. I have so many questions. Well, and actually, a lot of you guys have already hit on what I wanted to talk about next, which was those first couple of months. For a lot of you, you're going to organizations where you're taking over, where fellows are leaving off and leaving within the organization. Sort of what the first couple months look like in terms of navigating that transition, making sure that you are learning from the other fellows. How do you build off of the things that they left, or whatever the organization is providing for you, if it's a new organization where you're not replacing fellows. setting yourself up for success with your supervisor, just those first couple of months and sort of the different intricacies that go along with that.
So the beginning was kind of a big challenge in a lot of ways. You're moving into a new environment. Newark was, it's a special place. So it was definitely, new challenges coming along with that. I would say that one of the hardest things in the beginning, especially, but then throughout the year, was just, there was, worked at a crisis center. So, people are coming in crisis, and, even more so, their backgrounds were just full of, catastrophic events. And I had a background where I thought I was, pretty well prepared for it. But because we were health counselors, we had all this time to, really get to know the clients there. And I worked with all the females, so we just happened to divide it up that the U.S. fellow had the females and the international fellow had the males. And it doesn't have to be like that, but for whatever reason, that's how we just divvied up. And so I got all this time to talk with all these women, and most of them were pregnant, and I loved that. But you sit all these, hour after hour, and you learn about these, really terrible kind of backgrounds. And separating yourself and, not getting too emotionally involved is really hard. I thought that was probably the hardest thing for me throughout the year. Much harder in the beginning. And it gets better. Setting up boundaries is really important. And you think that going in that you want to be as open as possible. In some ways that can be detrimental. You have to set up, not huge boundaries, small ones. I still am pretty touchy-feely in clinic, and we're always in medical school, woo, Alice, some boundaries. But so you don't want complete boundaries. But it's good to kind of build some things in so that you can kind of maintain your mental health, and because you can't help people if you're stressed out. So I would say in the beginning that was a challenge, and by the end it got better. And it's something now that I think I'm a lot better at, especially since I see patients every day. I see some of my classmates that kind of came from more research backgrounds, and I watch them kind of going through the exact same thing. So I do think it's something that's natural and something that you kind of move through, but kind of the ability to set boundaries was a big challenge in the beginning.
I know more of you have answers to this question.
Sorry, I think the jet lags, I flew in last night and the jet lags kind of hit me that, and that combined with being overly caffeinated on Runa and the prospect of this being on YouTube makes me kind of shy and a little nervous. But, for me, the first few months, I leaned heavily on my co-fellow. My partner was Kelvin Kampambali, and he was my introduction to everything. It was really new. I'd never been to Malawi. I hadn't worked in that part of the world. And I relied heavily on that. So I'd encourage you all to do the same. The one other thing I'd say is that that's sort of in line with just an idea of patience. I chat about this sometimes. I mean, what's really unique about Global Health Corps is, and I've said this before, is that you all are just these energetic, maniacal global health machines. You were selected out of so many different pools of people that are incredibly talented, and so you're gonna wanna save the world tomorrow, right? And what is interesting is for many of you, you might go to, like I did, you'll go to an organization where you're the first fellows at that site, at that location, and what you may not even be aware of is that you represent sort of the first initial investment in that type of thing. They've identified that being a huge gap for them, and they need to do it. And so, for me, in terms of successes, it was a really slow, challenging, hard process. And recently, the national government has identified Malawi as sort of having the lowest stockout rate in the country of pharmaceuticals, and that's because of the Global Health Corps Fellows this year. And the team, the local sort of operations team, it's from the Global Health Corps Fellows and operations team the year before them. Not even, years later, it was the initial, there wasn't an operations team, I think, initially, and they identified this and then they grew it. And so, the impact that you're having just by participating in that can be huge, even if you don't yourself feel like you're really pushing the needle that week or those first few months or the whole even year.
Yeah, I just thought I'd add on a little bit. For some of you fellows, you will be going where there have been other fellows, and one of the challenges you'll face is, the previous fellows are the measuring stick that you kind of have to measure up to. And for some, that can be a challenge. For some, they're like, yes, I want to show them I'm better than anything anyone else has ever seen. And, people are different. But, I encourage you to, try to understand what has been done, try to understand what the previous fellows were doing, and try not to just jump in and say, okay, I got the silver bullet. I know exactly what we need to do here. I've done my analysis. But really take the time to understand what the other fellows were doing and figure out how can you build off of that. I think for me and Jane, we had the privilege of having, Alice, the previous fellows. They created some manuals that we used to understand what's going on and what we needed to do. So some fellows have that benefit. Some have created those manuals or just typed out some notes that, hey, this is what we're doing. You can figure out what you want to do in addition to what we were doing. So you'll find that. But for some of you, you may not. And it's very critical for you to spend the time to, appreciate what's going on. And then also, living in a new place that's got its own challenges, coming from where I come from, coming to Newark, New Jersey, and everybody telling me very fascinating stories about Newark and trying to figure out where should I go, where shouldn't I go, what should I do, what shouldn't I do. And I think that's normal, and you don't need to be afraid of that, and just embrace it, and just be you while you're there.
And kind of building off of what Tinashe was saying on the social component, the first 3 months that I was in Uganda, me and my co-fellow were both a bit of kind of homebodies, I guess, and I watched more DVDs, bootleg DVDs, than I had ever before in my entire life. I watched an entire season of Gossip Girl in one weekend, and then I was like, okay, this has to change. I can't sit in my room and watch Gossip Girl every night. And the best thing that I did was actually join a gym in my town, and that just kind of changed everything for me. It gave me a place to go after work. It helped me meet a lot more people. I dragged my co-fellow with me as well, and then I think she wanted to kill me afterwards, but she came, and it was awesome. So I definitely say make an effort to reach out. I know it's not going to be comfortable in the beginning. Like Tinashe was saying, you have to figure out what is safe, what isn't safe. Can you go out at night? Where can you be at night? Those types of questions are really important, but don't let them force you to sit in your room and watch hours and hours of whatever, or do whatever other vice you have. So that was kind of one of the big things for me, and it took me a while to get to that point where I was really comfortable with finding groups outside of my little gated compound and doing more extracurricular activities. But I definitely say seek that out in the beginning, find friends, find whomever, and it'll really make a huge difference to your social side and your mental health, which I know GHC talks a lot about and cares a lot about.
Fabulous. So sticking to the first 3 months for a little bit longer, we did just have our first 90 days session today where Shauna Slack talked about setting yourself up for success in those first 3 months, which are really important. So sort of talking a little bit more about your relationship with your supervisors, how you set that up, what worked, what didn't work, in terms of maybe navigating blurry job descriptions, maybe in terms of figuring out how to work with a supervisor. Different experiences with setting yourself up in those first 3 months with your supervisor. Do we need to do an energizer?
Yeah. Anyway, I'll start. I think for us at Covenant House, we had a really good supervisor. She was really, really, really awesome and helpful. She tended to prefer supervising on the go initially. She wasn't one way, okay, let's meet every 2 weeks, every fortnight, we're going to have a meeting, and we're going to figure out, let's break it down, what are your deliverables, and, et cetera, et cetera. So, she wanted to, if you had a question, just go. Just knock on her door, and her door was always open, and you could get in there and you could ask what's going on, what's your problem, what do you need to get done, am I doing what you want me to do, am I going to get a good eval at the end of this? So I think in terms of, for us, our supervision wasn't as crazy or difficult as some other fellows may have had. But I think the important thing was you also need to show that initiative that you do want to, meet up. The Covenant House is it's a crisis center. So even when you do set up a meeting to meet and get supervision, crisis happens and that meeting doesn't happen. So it's really important to show that initiative to keep going and say, okay, we didn't meet that day. Can we meet, at your earliest convenience? And at times that supervision meeting is not going to happen at your personal convenience because she has to work, for us was she, our supervisor had to work around different issues and a lot of crises and stuff. So the most important thing about supervision, you have to show that initiative. You have to ask what's expected of you. You have to ask, am I meeting your expectations? And if I'm not meeting them, what should I do to make it better? Don't assume that if I do this more, I do that more, it'll make this supervisor happy. Ask and be specific of what they want, what you should be delivering, so that you can know where you're going and be sure that you're achieving the objectives that you're supposed to achieve.
I guess don't forget your peer supervision. I think one of the most powerful things was being able to look to your left and right and see the people who are working alongside you, maybe not in a supervisory capacity, and just remembering to kind of check in, like maybe about professional development stuff, maybe about like, why did you choose to do this? But just separating some time and putting it aside to be human with each other. It just, I think one of the most amazing things about this fellowship is that you're in partnerships. And as Bryan was saying, in terms of getting used to a new space, even just walking into a presentation and knowing that Maimuna, my partner, was there with me, it just it made me feel like things would be okay, because we could afterwards debrief and sort of think about what worked, what didn't, and hold each other accountable a little bit. And I think you will have a supervisor that might look different depending on the site. And there are going to be situations in which they might not be as available all the time. They might be unbelievably available. But don't forget the folks on the sides.
And just a note about communicating with your supervisor, I had this great experience in my first few weeks at MVP where my supervisor had asked me to write up some report about something, and I emailed it to him, as you do. Everything's done over email, right? And 3 days went by, and he came up to me, and he said, Genevieve, where is this report I asked you to give to me? And I said, I emailed it to you 3 days ago. And he said, no, you can't do that. Whenever you email me something, you have to come and let me know that you've emailed it to me in person. And so for me, this is totally mind-boggling. Everything that I did throughout college and any other job I'd done was always over email, but for him, that system really didn't work. He had 4 different email accounts. We didn't always have internet, all this different stuff. You know how it goes. So that was a big lesson I learned in just kind of basic communication with my supervisor, figuring out what channels are going to work for you. It may not be something as fundamental as email versus handing someone a piece of paper, but just really thinking about what's going to work best for your relationship and making time to check in with your supervisor. I know my co-fellow and I both had to kind of spearhead that and say, hey, Dr. Emma, we really need a chance to sit down with you and talk about X, Y, and Z. And he was always so welcoming and so excited that we had specifically asked to talk to him. But he's an incredibly busy guy, so he was never really able to approach us. But just because your supervisors are busy, don't be afraid to ask to make time. They really are there to work with you and do want to work with you. So again, figure out the communication component, make sure you've got that together, and then don't forget to approach them and ask for advice. They're really there to be your mentors in most cases, and whether that's meeting once a week or once a month or twice a year, they definitely want to be there for you.
Awesome. So moving from setting up successful supervisor relationships to setting up successful co-fellow relationships, another thing I think you guys touched on briefly. What were some of the successes and challenges, both in the beginning, but then also sustaining a good relationship or a working relationship to be successful throughout the year with your co-fellow?
So my co-fellow, because we had separated them based on gender, there were some tasks that were kind of separated, and so it was sometimes a little bit of a divide and conquer. But some areas were not at all. So about midway through the year, we got a mobile health van, which was amazing. It parked right outside the Covenant House, provided like full range primary care, and that's something that Grace and I did a lot of work on, because it used to be that everything in medicine seems a little more complicated. I felt like in Newark, it's like getting to visits, and then you couldn't find the kid, and you were like running up to the chicken shacks. They were missing their prenatal visit. So we had this van that parked right outside. It was perfect. They provided full care, and so I think having a project that neither of us knew anything about this. The van had just started, and so to kind of separate tasks and work together allowed us to focus on things that fit both of the groups of kids we were working with. So I think a common kind of project and a common goal is really helpful.
Widen your social circle. No, I mean, you guys are going to be living together. You're going to get, like, real close, like, really close, like, competing for, like, toothbrushing time close, which is awesome and great, but, like, you don't have the luxury of getting to turn off the off switch when you leave the office. You are living with your colleagues, which is amazing. It means that you can stay up at 11 and sit at a kitchen table and have in-depth conversations about global health and what you want to do with your life and why this is meaningful. But it also just means, like, it's okay to take a little space. It's okay to kind of broaden the circle of people that you interact with. I think some of the most powerful relationships that I made throughout the fellowship year were with fellows, but also folks who were affiliated but not necessarily in the fellowship. I currently live with a staff member that I met at Partners in Health, platonically, and I just went to a friend's. I mean, like, we're just good friends. But but like, I went to another friend's wedding a few weeks ago, and a friend also from the Global Health Corps helped me find the job that I currently am in. Like, the networks that you'll build aren't just specific to Global Health Corps fellows, and I think together you can kind of, get out, see what's out there, kind of have fun. And I think in most of the places where people will be housed, like, there are unbelievable individuals who are working in these places. And just taking the time to kind of focus on the soft stuff and not stress out too much about what's coming next, I think will naturally allow for the things to come next. And I think it also takes a little bit of pressure off of your relationship with your co-fellow.
Okay, so I'm a married guy, so anything I say here stays here.
This is going on YouTube.
But I think what you realize as you go through the fellowship, and especially if you're staying with your core fellow, is that it's almost like marriage. You kind of have to, study your core fellow. Okay, I'm going to change my words. But study your core fellow, really learn who your core fellow is. What does your core fellow prefer? How do they do stuff? Are they the kind of person that spends, they don't have a problem coming back at 2 a.m. every single day, or they want to be in bed by 7, and you want to be chatting at 8. That doesn't work, because in reality, you're very different people. And more often than not, you're all going to be coming from different countries, right? You're all coming from a different country. So the differences are super, super magnified. And I think the most important thing you can do for your other fellow is study them. Understand exactly who they are, what they like, what they don't like. You have more than enough time, a whole year, to figure them out. And I can guarantee you, even at the end, you may not have figured them out. That's okay. And I think that's what's going to make the difference of whether or not you get along or you do not get along with your core fellow. And be willing to accept the differences that may exist between you and your core fellow. I love Jane to bits, and she's a good friend of mine, but I can tell you, over the whole year, me and Jane worked together. She only answered my phone call 4 times over a 12-month period. And this is the 3rd year out, and she's still probably at 7 now out of 3 years. But she's just different in terms of she likes texting, she likes Facebooking. I want to talk to you, I pick up my phone. So automatically there's a conflict. Why isn't she picking up my phone? It's like, this is crazy. What if I'm going to die? What if I'm in an accident, you know? But, you know, you're laughing, but for some people, that is something that they find they take offense to. This person doesn't answer my calls or doesn't respond to my emails or, you know, and you may feel that that person doesn't care. But really, they're just different. And you need to embrace those differences. And I think that's what makes a difference in terms of long-term, how your relationship will be with your fellow. So my piece of advice, study your fellow as you would your spouse or girlfriend or boyfriend or your significant other. Because really you're going to spend a lot of time with that person. And my favorite saying, one of my favorite saying is, assumption is the lowest level of knowledge. Never assume anything. Never assume that your fellow is mad at you. Never assume your fellow doesn't like you. Just ask them, you know, and just get it out of the way. Because I think a lot of times, a lot of relationships struggle because we assume that this person feels this way about me or doesn't feel this way about me. So my encouragement, study your core fellow. They are very different people, and I think that's what I can say about that.
Awesome. So moving into sort of office navigation, a lot of you are going to be working at multinational organizations where you might be at a country office, but working in some capacity or another with headquarters. And so that can be a complicated thing to navigate as well. And so some of the folks up here have had to deal with some of the complexities of working in a country office where you are dealing with both the politics of that country office, but also the politics of a wider organization. So not all of you, but I know a few of you had some thoughts on that.
So again, I worked with Millennium Villages Project in Uganda, and Millennium Villages Project also has their main headquarters at Columbia University in New York. And one of the projects that I worked on last year was with Sarah, who's now a current fellow. And she was actually there the day I got to Uganda and was only there for a couple weeks overlap, but I got to take over the project that she had started. So I had this connection to Sarah and to the New York office, but also was working for the local office in Uganda. And there's definitely, with MVP, there's always kind of this idea where you don't have enough resources for everything. Getting to the field is sometimes a challenge. And certain projects are prioritized over others. And one of the things that was tough for me to navigate was when you said something was for the New York office, it was more likely that you were going to get resources to do that something, which was kind of tough for me to deal with. You don't want to have to play this card and say, oh, I need this because this higher level person needs this to happen. So that was kind of an ethical issue for me in some ways, figuring out when I needed to play that card in order to really get my job done and make sure that I was fulfilling the role. But when I really needed to take a step back and recognize that other projects were also high priorities, and really even help advocate for some of the people working in my office to make sure that they were either able to piggyback off of the resources that I had access to, or saying, you know what, today I don't need to go to the field, I can do this over the phone, take my seat in the car. It's going to be kind of simple trade-offs like that can really make a difference for some of your other coworkers. So I'd say just definitely be aware of the politics that exist, be aware of the power structures. They'll probably be there in every single organization that you work with from now till the end of your life. So just making sure that you're playing the cards you need to get your work done, but not to the extent that you're hindering the work of other people. And I think MVP is kind of a unique project in that sense, and that I was kind of working across a couple different countries with the local office and the national office and the regional office and all of that. But just definitely be aware of the politics. Ask people about it. People will always have opinions on the structures that exist. They'll have advice for you. Make your own decisions, make your own assessment of the situation, but definitely don't be afraid to ask about the structures that are in place, because it can really help you in the end.
So as you heard sort of in the previous session, PIH sort of has an interesting, a really deliberate model for sister organizations where, you know, they're autonomous. They have their own leadership structure. They're really empowered to make day-to-day decisions, to really push the vision of what they're trying to accomplish in the communities in which they work. And so I didn't have too many experiences with sort of similar about navigating so much a political climate. One thing I thought was interesting that maybe is worth sharing is one of the benefits to having sort of a multinational organization is you have incredible resources and amazing work that's being done at other projects that it may be very related to the work that you're trying to accomplish. And I remember about 6 months into my fellowship, the director of monitoring, evaluation, and quality came through NANO, came through Malawi and hosted a training for quality improvement. And for those of us in operations, sometimes you can get so focused on just like the day-to-day work, just trying to keep, you know, medicine on the shelf, trying to make sure that the diagnostic system is producing the information for clinicians to do their work, and you're just so caught up in that you don't have an opportunity to almost step back and actually think about, well, what's the system as a whole doing? You know, like, what am I really trying to do? Like, if I'm working sort of in this siloed approach of just trying to keep medicine on the shelf, and I don't kind of step back and saying, why isn't it on that shelf by itself? Why isn't that just naturally happening? I think, you know, for me, it was almost like a, whoa, like I haven't actually spent a few days just thinking about like where the pressure points are on this system. So I think that was a benefit. So for people that maybe don't have that opportunity where they sort of have deliberate training moments where they can step out of the day-to-day work to do that, I'd encourage you to try to just seek that yourselves, because it's invaluable. You're gonna get, there's so much work, and there's not enough people sort of focused on it and working on it, which is why this is so exciting, because this is more resources for this work. So you really have to be deliberate about that, or you could really just wind up day in and day out working.
Awesome. So I'm going to keep it to 2 more questions before opening it up to, oh, did you want to say something? Okay. Before opening it up to you guys, so you have some chance to ask your own questions. So this is more focused on Global Health Corps and the community. And so how did going through the program influence your perspectives and also your longer term career trajectory?
So I went through a couple things. At the beginning of the year, I started, and I kind of grapple with a lot of things. I've always wanted to go into medicine, but kind of this idea, I kind of grapple with getting a master's in public health or not, and I had this idea that I would do policy because, sometimes things can be frustrating on the ground, and I was like, maybe if I did policy, then I could do kind of this top-down approach. So I applied, like, in the very first couple of months of the fellowship, got into a program, and then I realized through the end of the year that I really just like talking to people. Oh yeah. Is it not on? Oh, better, okay. So I decided that by the end of the year, what I really just liked was talking to people, that I really kind of didn't like the Medicaid paperwork. We'd sit forever doing forms, and I was like, wow, I really just like, more of the one-on-one interaction. So that was a big thing for me. So I didn't go to grad school, and then I had some time off. But it was those kind of one-on-one interactions. Particularly, I loved working with pregnant women, which is what I did a lot of. And I felt like, even now I have like male patients. I'm like, oh, I'm just not as good at this. Just like can't really make as many connections. They don't get the same jokes. But it was those one-on-ones with the females at the Coven House that really kind of solidified why medicine. And So that was kind of, I had some time now that I've gone in, and it's still now the patient interaction is kind of my favorite part of medicine. And that wouldn't have happened without the Coven House. I think I could have been, maybe somewhat happy doing policy, but it took that kind of full year to really kind of, focus in on what's really important to me for kind of life trajectories.
I had kind of like the opposite decision-making process. So the reason why the program that I worked for doesn't exist anymore, I think there are a lot of different theories on this, but I think my biggest concern was the financing component. Is this unbelievably beautifully run community health worker model that we did cost effectiveness studies, we did all this stuff, and just nothing quite stuck in terms of sort of showing effectiveness of the program. Literally would write reports to Medicaid to try to get these community health workers Medicaid reimbursed. And community health workers at that point were not Medicaid reimbursable in Massachusetts. And this was a philanthropically funded initiative that it was over 10 years old. It's really hard to get funding. And I think I loved the work that I was doing, but was so struck by the inability of the people implementing this absolutely wonderful program to navigate the kind of policy level infrastructure, which is what inspired me to go back to school and get a master's in health policy planning and financing. And I think I still do want to do implementation work, but I just wanted to be able to speak that language. And the other sort of more nuts and bolts thing that I think Global Health Corps did, as I mentioned before, is that it created this unbelievable network to be able to explore some of these different interests. And there are fellows, everyone sitting here has an awesome background, and I got my job through another fellow. It was very tangible impact from Global Health Corps. And so it was both the intellectual development as well as the more practical connection.
So Barb earlier mentioned that GHC is, for some of us, is the gateway drug to global health. And I honestly, that I can relate to that. It really resonates with me. I'm sure there's some of you out there that are like me in this regard, where I always had an interest in global health, always wanted to do it, but just couldn't figure out the way to do it. And life kind of has a way of just keeping going on the path that you're on. And so for 8 years, I sort of worked in domestic health, sort of consulting, and just always with an eye, but looking for the right sort of opportunity. And and so for me, GHC had a profound impact on my life. It's why I'm in global health right now, and it's huge. And I think it's probably that for many more, and probably for many of you in here. What's interesting to me that, I don't know, shout out to Still Harbor, but have Still Harbor started doing the how to sustain yourself in that? Is that the mid-year or end of the year? Have they introduced that already in the training, the how to sustain? I mean, for me, that's profoundly interesting. It's a really difficult thing. How do you, there's so many pressures, and the work is so hard, and it doesn't pay the best, right? And so how do you sustain in it is a real topic. And for me, what I found to be one of the biggest ways to sustain it is these communities, the people that I get to see and relate to, and that anytime I'm feeling like I'm struggling in passion and mission, it's just an onslaught, a wave of it from my co-fellows and the new class. I mean, this is ridiculously inspiring to see this. And so I think, I think GHC's unique in that regard.
As an alum myself, I'm going to chime in. And obviously there's also a bias since I went straight from the fellowship to working for Global Health Corps. But I can't say more about the networks. The past and hopefully present fellows become your best friends as well as your colleagues. You have not only this cohort around you, but also all of the alums. invested in your future and success. Like, they want to see every one of you succeed and thrive and be amazing. And having a group of people that have your back no matter what and are excited to be there for you is the most precious gift, at least for me, that I ever had. Like, just knowing that I wasn't alone in any of the work that I was doing. During the year, it was not only my co-fellow, but everyone else in the country and in the GHC community. But then since then, it's been a wonderful experience consistently having a group of people that I can always call on, both for intellectual things as well as resources, and also a wonderful and robust social life. And so bearing that in mind and investing in those relationships is incredibly important. Okay, and so my last question, which I sort of answered myself also, if you could give one sentence of a piece of advice that if they couldn't remember anything else from this session except for that, what would your parting sentence be?
The one thing I'd add is, and we've chatted about this, Jen and I, a bit. Many of you are going to be going, most of you will be going to places that are different from where you're from. And a lot of times, it's when you see things that are different, sometimes it just doesn't resonate with you. You just think, oh, like, why does this take so long? Or, oh, like, there's such a better way to do this. And I think a lot of times, it's really important to remember that sometimes things different can just mean different. It doesn't mean better or worse. There can be reasons that you may even be unaware of why things are the way they are. Sometimes you'll find out far along down the road that that actually was really important for it to happen that way. And I think to take a step back and not bring everything, I mean, it's hard. We're people with backgrounds and they come into play, but just to try to be cognizant of that as often as you can, and to be open and understanding of new ideas and new systems is huge in this fellowship year. It really will make or break the fellowship for some people.
So I would say there are going to be really tough times, and there are going to be moments where you feel emotions that you've never really felt before, whether it's frustration or loneliness or whatever it might be. I know for me it was definitely a really transformative, self-reflective year, and my main advice would be take time to just stop and appreciate some of the things that are around you, even if it's really small things. So one of my favorite parts of every day, if I was walking home from a really rough day, I was lucky enough where I could walk from my house to work, and I just love the goats in Uganda. They're awesome. So every day there's this herd of goats that would walk home with me, and I think appreciate the small things was actually something that Perry talked about. And so I thought about that a lot, and I just loved walking home every day with this herd of goats. And it was just such a great moment for me. I could just be totally relaxed, just really appreciate the beautiful, beautiful city of Mbarara and realize how lucky I was to be there, to be in this incredible community. So just when you're feeling frustrated, when you're feeling lonely, and when you're feeling like you just want to go home, or you just want the mice that poop on your bed to die, because you'll feel that too, just stop and find your goats, whatever they might be.
I have two things. So one, I would take, can you hear me back there? Okay, I would take every kind of opportunity you can, because the year goes by really fast, and now that I'm doing something different, I still haven't felt this kind of level of deep passion. When I started the fellowship, it was just thought it was like the greatest thing ever the day I started the training, and I think you look back on it, and you're so fostered in this environment. There's so many people willing to support you, in every way. Your future trajectory, mental health, everything, and it's a unique situation. You have so many people around you. Always willing to be a support system. So I would take those extra opportunities, because know that this is, it's a very special time. And secondly, I would find a good mentor. It can be anyone. I worked with another girl who ended up being a really close friend of mine that I still see, and I'm really close to the fellow that I replaced, Bertha, and she's been an enormous resource for me. going through medical school and in life and with boyfriends. And I would say find that good mentor that when things get tough, you know that, you have someone you can call that understands what you're going through.
I think for me, she kind of already touched on it. This is extremely unique experience. And I know you're in the hype and you're enjoying it. You're like, oh, this is awesome. But let me refresh your memory in case you might just forget. This is awesome, okay? And I would like everybody to say this. This is awesome. Can you say it with passion? This is awesome.
This is awesome.
And I really want I want that to sink and resonate in you and take full advantage of where you are. It is a very difficult thing to find 150 plus people in the same room with the same vision from different walks of life and different disciplines. Maximize as much as you can. You may not be able to connect with every one of the fellows. You may not be, best friends with all the other 140 fellows. But maximize and be intentional. You're going to be gone from Yale in a couple of days. And it can be very easy for all this, oh, that was a good time. Oh, that was a great time. Be intentional about it. Make those good times, great times last. I'm very grateful for Global Health Core, and I'm sold for the GHC. I would die for the GHC, It's been a great blessing to me, and make full use of your core fellows. Abuse the leadership. They got great hearts. Abuse them in a good way, okay? I'm not saying, tear their lives apart, but they really are awesome people, and they really want to help you grow and be all that you want to be. So my advice, please be intentional, be deliberate, and make full use of the connections and all the people that are next to you.
Maybe just use us in a very proactive way.
Have fun. No, seriously, you're gonna do great. That's why you're here. Do your work with integrity, but stay grounded. Have a good time. Shake your butt. Get out. Meet new people.
Awesome. Well, thank you guys so much. I want to turn it over to questions from the audience. But before I do that, we have a couple of other alums who are with us, and I figured we might as well take advantage of having them be able to answer some questions too. So I see Yvette and Oliver and JJ. Do we have other alums in here yet? All right, will you three come up with us? Sorry to put you on the spot. And Armand. If you guys wouldn't mind just taking a moment to introduce yourselves and say what class you were in and say hi to one another. And then we'll open it up to questions. If you have specific questions for specific people, then you can target it to them. If you have more general questions, then anyone can feel free to answer. But if the four of you would just really quickly introduce yourselves and where you were and all that jazz, that would be great.
Well, hello, everyone. I'm JJ, and I was third year along four. So it's great to see everybody here. I've been in the field for for the past 3 years in Rwanda with Partners in Health, working on non-communicable disease research capacity building. So I started as an M&E fellow, moved on to research. So I do both, and it's really exciting to be back, and seeing all of you here brings back memories 3 years ago. So.
My name's Oliver Ho. I was an M&E fellow at Gardens for Health International in Rwanda in 2012-2013, and I'm now a research assistant in the Healthcare Policy Department at Harvard Med School, and I'm really excited to be back. And I'm going to give one quick piece of advice before any questions, which is just avoid Shema with all. Don't wrestle with him. Avoid bear hugs from him. He's very dangerous.
Hi, my name is Yvette Efabera. I was also with the 2011-2012 cohort. I was with Mothers to Mothers in Malawi. And after that, I worked in DC in the private sector for a bit. And then I started my doctoral program at the Harvard School of Public Health, which is where I'm at now.
Hello, fellows. Hello, fellows. I can hear you. Okay, so my name is Armand Giramahoro. I'm a global health core for class 2012-2013. I worked for LifeNet International in Burundi as a management consultant, and then I have been recruited after the fellowship as an administrative officer. So I worked for LifeNet International in terms of building relationship with government and increasing the number of partners. LifeNet International is a US based non-profit organization which work for improving the healthcare of the poor by increasing the capacity of health clinics, church-based health clinics. So now I am who I am, Burundi program manager, and I am very excited to be back at Yale among you. And yeah, it's a great pleasure to see Oliver. Merci.
Awesome. So let's open it up to questions. And we've got folks coming around with mics.
I have the mic over here, the first one. Sorry. Hi. My name's Chad, and I'm also I'm going to Malawi. Pretty excited, stoked.
When you guys ask questions, will you stand up too?
Okay, sorry about that. Yeah, many of us, me specifically, I'm very overwhelmed and filled with anxiety. I know a lot of us as well. I guess perhaps maybe that first moment, whether it was 3 months, 2 months, 6 months, 11th month mark, that you felt like you made an impact. And how did that look like? How did you feel? So if you can kind of share some of your experiences about that.
Who has a mic? And who wants to answer?
Well, so I guess I was the first person who had kind of an M&E role at Gardens for Health, which is, was a very small organization and has been growing pretty rapidly. So I think, you're really gonna feel the impact you're having the first time that like you do something or you say something that nobody else in the organization has thought before or thought of something in a certain way. And coming from all the different backgrounds that you're coming from, like once you're there and once you get a sense of what's going on, that's gonna happen for all of you. You're all gonna have some insight that nobody else in the organization has had before. And so I think that's what it's gonna look like and feel like for each of you. Like just when you see a look in people's eyes, that's something new. And that's why they have Global Health Corps Fellows, to bring something new into the organization. And so I think just try to look for that moment and be happy when it comes.
So I had a really interesting experience. My co-fellow left after the first couple of months, and then my supervisor left as well. So it was just me and the monitoring and evaluation department from Mothers to Mothers. And I think that, for me, it was a really challenging start, and I was doing things all constantly, and I constantly wanted to do things, and I would maybe do a survey here or work on this project there, and I knew I was accomplishing something, but it didn't really feel like any major accomplishment. I think for me, when I think about my actual fellowship experience and job, it was really after I left GHC that I really started to realize what an impact that I was able to have, but also the impact that it had on me. But I think also looking at the way that my relationship with my coworkers changed, for me really meant a lot. Because in the culture, I came in, I was a Westerner, I came in with these strong ideas and this way of doing things. and it didn't necessarily work. And it took me a long time to really figure out how to communicate, right, in a way that didn't seem like I was trying to tell people what to do, but that really respected their culture and their values, and that showed that I cared about those, because I did. And at the point where, you know, they started inviting me out to lunch all the time, or, you know, when I was no longer just the person sitting in this office in the back, but that I was really kind of integrated into their everyday conversations. I think that really said a lot in terms of the connection that I had, and their willingness to allow me to be a part of their family and their experience. And I think one other thing to just add, you know, I said my experience was very challenging in terms of my day-to-day operations, but I decided to look elsewhere for something that really motivated me. So I started volunteering with a youth mentoring program in Malawi, and for me it had a really profound impact. It, for me, solidified my passion in working with youth and young people, but it also was a very tangible way of seeing change happen as well. And I think the relationship piece is a lot of it, but then at the end of the day, when you really just step back and you take that time to chat with, you know, your other fellows who can see things that you can't see from the outside and who continue to motivate you, I think it really helps. So it's not at 3 months, for me it wasn't, but I think that when I look back on it now, there were so many little signs that I didn't realize were there the whole time.
I have something to say also about your question. There are two moments that really stand out to me. The first was like about a month in, my co-fellow and I were chatting. My co-fellow and I were chatting, and he and I were wonderfully good friends, and we had a great rapport. And I was throwing some idea about something that I had that I thought was so brilliant. And he turned to me and he's like, "Jen, you have no idea what you're talking about." And it was wonderful, because it gave me the permission to be a student of the organization and of the culture and of the community and what's going on, and not like, oh, I'm here and I'm supposed to make this big impact really quickly and I have all these answers because, you know, I've been studying this or doing this. And it was one of those like blows that at first I was like, oh, and then I was like, wait, that's awesome. Like, I get to sort of press restart and sort of come into it completely open and empty of ideas at the beginning, and fill myself up and then figure out things all over again. I think every time you start a new job, even if it's in a place that you've lived your whole life, you need to start over again. I mean, you get to pull from the things you learned before. And so that was wonderful. That was like that moment of like clarity for me. And the other was when we did finally come up with a really great idea, we decided to engage the village headmen and the communities around us, because we were recognizing that we just weren't getting a lot of patients in those communities. And we went to do a training with them, and they were like, you know, organizations always come and ask us if they can have access to our communities, but you're the first that's come and asked us like to be involved. And that was another really huge moment of like, oh, these, you know, they're not just village headmen and they're not just, you know, the leaders of their community, they're also people who want to be engaged too and like want to be involved in this also and have a stake in their community. And no organizations seem to be recognizing that. So those were two moments for me that were really big. Yeah. We probably aren't all going to be able to answer all of the questions, so maybe we should move on to the next one.
I was just wondering what some of you may have organized for the community event during your fellowship years.
Anybody?
Testing.
Yeah. Oh. That is new. That is it's not new to this year. I think
we did a community event.
That's true.
I'm going to defend us here.
Okay. Okay. Thank you.
We did one. And so the group that I was working with, I think there were about 5 or so fellows who were able to come, and we did like a day-long mentoring session talking about, so it was a group of post-secondary students who were looking to go to college. And so I remember Eric was there and Jen was there and some of our other Malawi fellows. But we basically spent a day working with youth and talking to them about their passions, and actually many of them were interested in health as well, which was kind of fun, and kind of helping them think about writing a personal statement. So we did something.
We did do something. Yeah. Can we get the mic down to Jeff?
I'm sorry, I already brought up the gym as one of my favorite places in Mbarara, and we did an event with the Red Cross that was kind of a health and fitness day, and we reached out to the university in Mbarara and got a pretty good group of about 20 people to do a little health and fitness discussion about nutrition and focusing on foods that you can find in the market and the importance of eating green things in addition to Maduke, which is sometimes tough to get across. Although I do miss Maduke. And so that was really fun. And then another thing I did in my office that wasn't really a community event, but I found a lot of the staff in the office, when they were applying to jobs, maybe I shouldn't have been helping them apply to other jobs, but with hindsight, but that's okay. They had these really, really long resumes that are great if you're applying for Ugandan positions, but resumes that are 10 to 12 pages long tend to not be so successful when you're applying to a US or UK-based organization. So I helped people, not that I'm an expert in this in any way, but I helped people find resources to make 1-page to 2-page resumes. So I worked with 5 different people in my office and created resumes for them, which was also a great experience for me as someone that is still in the process of figuring out how to make a great resume. So that was something that was kind of cool, and it was a great way to get to know people and ask them about what they've done in the past and learn about the things they feel like are important in their professional history. So that's something that was kind of fun that I stumbled into.
Awesome. Let's go to the next question.
Thank you. Hi, my name is Nchimunya. I'm from Zambia, and I work in Zambia. Yeah, so we've been here for like 2 weeks, and we've listened to amazing people talk to us. We've heard and learned so much. So my question would be, in your experience on the job, to what extent or how much did those talks apply to what you were actually doing? Thank you.
Oliver.
So I don't know if you guys got the same talks we got, but we had a log frame talk, logic framework talk, and I found that really useful. And if you didn't get it, or if you want to go over it more, I'm going to be doing a session tomorrow that includes it, so you can come to that. But it was really useful to walk through with the organization Gardens for Health when I got there and try to help figure out what we should be collecting data on and all that kind of stuff. So I think there are definitely, there might be, that was one really concrete thing, but I think, whatever your favorite talks were from these 2 weeks, they were your favorite talks for a reason, and they resonated with you for a reason, and they're going to be helpful to you in when things are really tough, reminding you why you're doing the really tough work you're doing. And so whether it's something that's really kind of direct, like I just talked about, or something that is just like, that was a really inspirational talk. And that reminds me why I'm here doing hard work wherever it is that you're going to be placed. So I would say, like, at a minimum, take away inspiration from the 2 weeks, and hopefully there's something that you can really apply.
Going to Zambia, and I almost don't want to ask this question because I want this year to go by as slowly as possible, but I'd be remiss if I didn't ask. So I want to know, when did you all start thinking about what next, about that next year?
Let's get the mic to Tinashe.
I think from the day they say training is over. You know, that's a, you know, everybody is different in how they stratify their lives. Some people live life moment to moment. Some people like to plan 5-year, 10-year plans. So the answer to that is rather, you know, it depends. It depends on individual preferences. I think for me, for the most part, I try to enjoy the moments as they go by day. And you know, at some point, you know, you kind of have to start thinking about, oh, so what's going to happen after this? But I think the more you can enjoy the moment, maybe set up a general framework to say, okay, after I finish this, I'm going to go to college. I mean, I'm going to do a master's. I'm going to look for a job. That may be all you need to do. Because for some, it can take a lot of your actual time, and you actually don't get to enjoy the moment because you're trying to think, what am I going to do? What am I going to do? So I think that one's it's a hard one too. There's no one answer for that kind of question. Some are thinking about it right now in this room, so it's a difficult one, and that really depends on the individual. I'd love to say don't worry about it until the last month, but that may put some people in panic attacks. So you know, it really depends. For me, I think I just started to think about it maybe halfway in. You know, I kind of knew I had to think about that, but probably halfway through my fellowship, I had to start thinking more significantly, okay, what am I actually going to do come July?
Yeah, I'd only add that, that GHC, they're intentional about their programming, so they build in opportunities throughout the year to start to think about that. So they do that at mid-year. They do it towards Q3 in particular. They start to really start asking what your plan is, what you're thinking, providing resume writing assistance or things like that. So, you know, I always, for me, I think I heard it mentioned that it's such a unique year, and this was my only brush with adult summer camp, the 2 years at Yale, and I won't get it again, likely. So, you know, I think to embrace it and to focus on that, and there will be opportunities moving forward. So, even if you are someone who really doesn't think about it, you'll be forced to.
Everyone in this room is going to be your colleague, as will all the people that you're working with. And doing your work with integrity is working on your next step. And I don't think sitting alone in a room on your resume, well, that sounds really awesome and fun. But like, if you're thinking about doing an MBA, there's someone in this room who has done an MBA. If you're thinking about doing a PhD, there are people in this room who have done or are doing PhDs. Like, soak it in. Good folks. No, but I mean, like, there's like concrete working on next steps, and then there's like just like recognizing that everything that you're going to be doing is working on next steps.
So I think maybe what we should do is take like 3 questions, and then people can popcorn which questions they want to answer.
Hey.
All right, we'll start with Olivier, and then we'll go to Devin.
I call third.
Over here.
Thank you. My name is Olivier. I'm from Burundi, and I'll be placed at Vesna Cares in Boston. My question goes to you guys who has been placed outside your home country. I know my question is like, we've gone through this throughout the sessions over and over again, but I want to hear the experience from you guys. It's like I have the feeling of great excitement and a little bit of anxiety for acclimating to the new environment and the challenges that you guys have faced. So my question is, what are the good times, maybe the challenges that you came across during your first days on the way you acclimate to the new environment, the way of working, and all of this stuff? How did you cope with that, and how did you overcome the challenges? Thank you.
All right, so acclimating to a new environment. And Devin.
Okay, this is my voice. My, my name's Devin. I'm going to be in Jinja, Uganda with Soul Foundation. Thank you all for coming today. This is awesome. This is kind of a touchy question, so if you want to approach me later and just not address it right now, that's totally fine, but I'd love to know. If anybody could speak to a time when you just flat out did not agree with a decision that your organization was making, or a decision that your supervisor was making, or even a decision that your co-fellow was making, how you navigated that situation and maybe what the outcome was, if you learned something positive from it, or if you just walked away like, wow, that was terrible, I never want to experience that again. Talk about that.
And I think I have the other mic over here.
All right.
I'm Kai. I'm from Providence and heading to Kampala. And I guess I was curious as to how your sort of demographic identities, race, nationality, gender, sexual orientation, et cetera, may have impacted the work that you were able to achieve, and to the extent to which those potentially presented challenges, how you were able to persevere.
All right. So we have acclimating to a new environment, disagreeing with important decisions, and how your identities impacted the work that you were doing. So if you want to pass the mic around.
Yeah, I got it. Okay, I guess I'll address the first two questions. I don't have any good insight on the third one necessarily. On the first question, I think Genevieve talked about it a little bit, like joining the gym. Like basically the things that make you happy at home are the things that are going to make you happy wherever you're going, and you may not be able to do them in exactly the same way that you were able to do them at home, but you can do some version of them. And I think everybody would agree that like one of the most important things at home or wherever you are is like having a good group of friends. So like that's the biggest thing, is like be invested in the community you have from Global Health Corps, because that's a natural group of friends, and then make other friends, and then find the activities that you enjoy at home, or as close as of an analog as you can. I mean, I joined a gym in Rwanda, and I found the gym really frustrating in a lot of ways, because like they took up most of the space doing these crazy aerobics classes, and there's like a 10 by 10 space for like all the weights and like anything that I thought was the important stuff in a gym. But at least there was a place that resembled what I enjoyed doing at home. In terms of disagreeing with an organizational decision, I'm gonna kind of skirt the question in terms of Global Health Corps, but I've certainly disagreed with organizational decisions at other jobs. And I think that that's always gonna happen, and when you work at small organizations or big organizations, like your ability to change the decision making is vastly different. And I think your reaction is, I think, really dependent on the organization and your relationship with your boss. And in certain places, you're going to be able to at least speak your mind. I think it's important, and hopefully you have a relationship with your supervisor where you feel comfortable saying, I disagree with this, and I respectfully disagree with this. Like, I understand you have your reasons for doing this, but like being able to voice your mind is a great place to be with your supervisor. That's not always going to be the case. There may be some situations, and you have to read it for yourself, where you just have to keep quiet. That's where your co-fellow, or in my case, in the organization I was working for before, the person I had worked most closely with on the project that was being kind of redirected in a new direction, and we didn't agree with, having spent all this time on this project, how it was being redirected. You go out to lunch with them, you get a beer with them, you go to dinner with them, you find time off campus to just vent a little bit. Like, that's an important thing. Being able to voice your mind and not keeping everything bottled up, all of your frustration bottled up, is really important. And hopefully you can do that with your supervisor. And if you can't, then find somebody else to do it with, and maybe that's your co-fellow, maybe it's another friend from GHC or from somewhere else. But don't keep it bottled up, because just being able to say something out loud is like half of the battle, I think.
So in terms of your question, moving into a different place. So I'm from Minnesota, so Newark was pretty different. And I remember one of like the first experiences, all these boys had these teardrop tattoos, and they can I'm still not quite 100% sure what they mean, but they could be gang affiliated. But I walk in and I'm like, what look at all these people with like raindrop tattoos. I'm like, he's got one and he's got one. And so I think, these types of things happen a lot. And I think the best thing you can take out of there is like, be able to laugh at yourself. Because I had many of these moments of like little things where people will be like, no, Alice, that means something else. And so I think like, be humble, but be open that, there's just things that you're not going to know coming in. And it's okay to laugh at yourself. And, everyone kind of, it's just the adjustment period, so.
Okay, I'm going to answer the acclimatization question. I think that's a very interesting one. So for me, I finished the fellowship training. I went straight back home. 5 days later, I was getting married. 9 days after that, I was back on a plane. I was in New Jersey, and I arrived in Newark, and my co-fellow decides to go somewhere for a week, and my supervisor goes somewhere else for 2 weeks. So, I really didn't have a lot of onboarding time. So my piece of advice when that happens, just flow with it. Just take the time to just understand what the organization is doing, meet up with different people in the organization, what are they doing, and understand what they're doing, and then try to figure out what your role is in that. So you can imagine, so the supervisor left. Unfortunately, she forgot to give keys to the office I was going to be in. So I kind of spent the first week kind of hopping from people's desk to desk, kind of say, oh, I got to use the desk. Oh, sorry, kind of, But you kind of have to, enjoy the moment and take it as an exploration and view it as such if you find yourself in that scenario. Second thing I'm going to say is, so the first night, I'm like, oh, I got to eat. So I, go to the stove, and I realize, oh, it's a gas stove. I'm like, great. I'm like, where's the matches? I can't see the matches. So I ended up eating, I think, cereal or something that night, and I kind of slept. And actually, the stove, you just turn the knob, and it clicks on its own. So ask if you're not sure. Don't starve the first night if you're in a new place, okay? So I think those are some of the things I can talk about in the workplace. If you're not sure what you're supposed to be doing, just take the time to understand who's there, what are they doing, what, each individual person, walk office to office, and just, talk to them as people. And then from there, you'll be able to adjust quicker. And for all those from Africa coming to the US, the stove, nope, just keep going. It'll click, and it will light up.
So I'm just going to touch on the last two questions because I think they're actually really important. I think to your question about if you have a disagreement, if it's not a super serious issue, then I think, a lot of you probably know ways of trying to deal with that. But people are real, right? So it's very possible that there could be something that's very serious to you that could compromise your safety or your integrity or something like that. And I think in that kind of situation, I'm sure GHC talks about this, but they are here, right, as resources. I think you have to be very careful about who you say some things to. So venting, yes, is okay sometimes, but I think it's really important that if there's something that's very serious to you, that affects your well-being, that affects your mental health, that affects your safety, that really just compromises, what you think is appropriate. You really should take advantage of the amazing GHC staff and go directly to whoever your point person is and have that conversation with them. Don't wait. My year, we had some relatively, things that affected people's lives, essentially, that came up, and the staff was really wonderful about dealing with it. So don't be afraid to use them. And I think to the third question, for me, that's also a really important one. I am a first-generation Nigerian American. I identify as being African American. And going to an African country where I look like I'm supposed to be from there, for me was a really challenging situation to navigate because it was unique in Malawi. I had lived in other African countries. I'd spent time in a number of other places, but it was a different culture, right? They're not all the same. Africa is not a country. Surprise. So I think that, for me, I really relied a lot on my co-fellows and just trying to find what my sense of community was. And it wasn't about, a race or, a religion or something like that, but it was just about finding people that I felt like I could emotionally connect with and who were there to support me. I think GHC staff were there for me as well in trying to talk through some of these things. And I think now there are, formal resources, right? Like Still Harbor is here. They've got other sessions, I'm sure, that talk about all of these things. But I mean, it's not easy, and I think that you just have to remember, like, you are a real person, and you shouldn't have to put all of yourself aside or a part of yourself aside when you're going through another experience. But at the same time, you have to recognize, too, when you can assert what and how you can find a way to connect with people, because at the end of the day, it just comes down to not how you identify, but how you can connect.
I want... Carrie? So I wanted to comment on the first two really quickly. Also, another thing about moving, all of the places that you're moving, we have really incredible, robust alumni communities there. And so you don't only have one another to turn to, but you also have the alums in all these countries. And so you're going to have 30 people in Boston, in addition to the 7 other fellows that you're having in Boston, who will be there to help you acclimate. And you can ask lots of questions, and there are going to be a lot of people who are super excited to show you around and introduce you to weird foods and all of that great stuff. So take advantage of that. That's number one in terms of acclimating to a new place. You already have a system in place to help you do that. For disagreeing with organizations, I've said this to a number of fellows who I've worked with in the past. This is 1 year, and I know some of you are probably going to hope to try and situate yourselves to getting hired by the organizations after, but at the end of the day, that's not guaranteed, and it's an interesting opportunity to maybe figure out how to have some of those harder conversations with a little bit less to lose, in terms of, knock on wood, you're not going to do it in a really in a disrespectful way that will get you fired. But we're all change makers. We're here to change the way that things are working, and you're going to probably see things in your organization that after you've learned all of the cultural intricacies and things, you do come to the conclusion that things could be done a better way. I mean, obviously they can, or else the world would look really different than it does right now. And maybe you have ideas of how that could be different, and your organization or people in your organization might disagree with you. And figuring out how to have conversations to change people's mind, this is an amazing opportunity to be able to get to experiment on how to do that. Because it's a very safe space in a lot of ways. You have people to collaborate with and try and figure out how to have those conversations, and then you have a little bit more liberty in getting to have those conversations without jeopardizing yourself in the same way where you might be afraid, thinking, oh, I need this job for the next 5 years. I don't want to situate myself so that my supervisor, doesn't like me. And so just thinking about that is important, because we're all trying to figure out how to make institutional change. And part of that is having conversations, because you're going to disagree with things sometimes. And also being open to realizing that you were wrong about it and that actually they're totally right, But having those conversations is super important. Okay, so we still have a little bit of time. Let's do 3 more questions and then a couple more answers and see where we're at. Cool. Start with you, Jen.
I was wondering how you maybe educated yourself outside of like the day-to-day job to really equip yourself to have the biggest impact possible. So, for example, one of my job responsibilities is develop an intervention to reduce maternal mortality, which is really broad. Or just, if you wanted to learn specific skills or anything like have access to literature that could better help you know how to help people. I'd be curious to hear what ways you engaged in that.
Do we have someone else with the mic? Yeah.
Hi, my name is Fales. I'm from Zambia, and I'm going back to Zambia. I'll be an M&E fellow under ECPAC. I wanted to find out from those of you who worked in the monitoring and evaluation department, what innovations did you leave during the times you were fellows, and did you leave a legacy? Do people look back and say, oh, she did this, because I just have these dreams with my co-fellow of doing great things, so I wanted to learn from you.
Hey guys, my name's Ariel. I'm from Rhode Island. I'm going to Zambia. Thank you for this discussion. It's so helpful. I just had a question. We've talked a lot about this this year. It's been 2 weeks. Not a year. Oops. About like writing blogs and using media and kind of like reaching back out to your communities at home, your families, your friends, and talking about the work that we're doing and in a way to raise awareness, but also just to kind of talk about the year. And I was wondering, I kind of struggle with how to do that in a powerful way, but a way that also doesn't kind of generalize or exploit or just demean the work or the people that we're with. And I was wondering if you had any advice for how to do that type of communication.
Awesome. All right, who wants to take a gander at this?
Now I have the micro.
Fabulous.
So, I just want to react on your question vis-a-vis how resourceful you can, like how the availability of resources. The GHC community, I hope now you are, and I'm sure that you are on the GHC email community. I can tell you this is a great continuing education and great resources in terms of especially the related work that you will be doing. I remember not my class, but this current class at LifeNet International. And first of all, I'm going to tell you one thing. Our placement organizations, they count on you a lot. They count on GHC fellows a lot. They think that they are aware that you are a huge community composed by excellent and smart guys, intelligent and very well educated, because you know yourself where you come from through the competition, through the recruitment process. So they are aware about that, and they want to make use of you during the whole year, and just because they know that you have great resources. And now I found that this GHC email community is a place where really all the fellows can be helpful among each other, including the alums. So I remember Tal, the fellow of LifeNet International this year, he has built the whole curriculum of a business program just by collecting, those pieces of information, resources from fellows who are in Rwanda, Malawi, alumni, and all of that. So I really encourage you to use this community network and maximize, be confident and trust them, because these are the best, the best guy of the world.
I would like to address the first two questions about, I think the first question is about how do you educate yourself, and the second is how do you leave a legacy. So the first, in terms of educating yourself, I think you can, my philosophy is you can read all the books and papers you want, but the best way to really get to know the gaps in the situation that you're trying to address is to really talk to the people around you in the field. Because they've been there and they know what's needed, and you're new, and so you may not know. You can read that there may be a gap somewhere else in a paper, but that the solution that they've come up with may not address your specific situation. So I would say get to know your colleagues, get to know the situation as much as you can, assess the gap, and then this is basically a baseline assessment before you try and find literature on something that you are trying to address. And secondly, about the legacy, I don't think we should ever think about what legacy you're going to leave, because I think you're going to get disappointed in yourself. I tend to sort of think, again, it relates to the first answer, is that what are the gaps on the ground, and how can I bring my skills to address these gaps? And then if you can address these gaps, I think your value would automatically be there. And so that would be my recommendation.
So on the second and third questions, I definitely agree with what JJ said about, thinking about a legacy is a really ambitious way to go into the year, and that's great to be ambitious. And I think JJ's probably being modest in terms of like what she was able to do in terms of filling gaps, and like certainly a lot of organizations have M&E gaps, and you can do, there's a million different things. There were a lot of things that I put in place, working with outside organizations like Bear Solutions to put in place a Salesforce database to support Gardens for Health. But you can only do that if, as JJ said, you have talked to everybody who's in the organization already and you understand how M&E is going to be helpful to them, not just how it's going to be helpful to you because you think this is what needs to be collected for your program because it's a certain type of program and there's a certain type of data that should be collected. Making the lives of the people who do the work on the ground every day easier is really how you can have the most impact in M&E, I think. And that doesn't start with saying, I'm gonna do this before you even get there. You gotta get there, then figure out what other people need, and then go and do it. On the third question about how to communicate back to people at home, I think the best way to do it in a way that's respectful to the people you work with and you live with and you're friends with and the work that you're doing is not to try to tell everybody at home everything that happened every time you communicate. So whether you're going to have a public forum that's like a blog or something like that, or it's just a certain private email list that you send to your close friends and family, picking like individual stories and then really kind of like telling those in a full-fledged way is a way that they can get a sense of what's going on in your life without you feeling like you're generalizing over lots of things. So picking an event and writing about it for several paragraphs gives them a sense of how you're processing things in your life away from home without being like, things are really tough here, this happened, this happened, this happened, this happened, this happened, I miss you guys. I think like one event and focusing on that, and then like maybe at the end you just say like these are some other like events that happened, but like focusing on something specific will make your writing a lot better and make your life come alive a lot more to the people who care about you back at home.
To talk a little bit about the first question, I think one thing that I really loved doing was just asking people about their backgrounds, their professional backgrounds, and again, coming right out of undergrad where I studied public health and African studies, which is kind of great, super broad liberal arts education, and I realized I had very few hard skills. And one thing I loved was that I became really good friends with the e-health specialist, who is just like Toko, who you'll meet, and he's programmer extraordinaire. He knows how to do anything under the sun with a computer, at least from my perspective. And he ended up being a really great ally for me. He taught me how to use OpenMRS. He taught me how to work with ComCare, which is the mHealth system that MVP uses, and just really learning about the people you work with, finding the people that want to be teachers and want to share their knowledge with you, which I think you'll find a lot of those people. That was really a pivotal point for me, was realizing, okay, I don't have this set of skills that I wish I did have, but the people in my office and the people I worked with often had a lot of the skill sets that I was really looking for. And also one thing that I know emails get passed around a lot are about online courses. And a lot of folks in my year did online courses during their year, and I did one as well. Internet connectivity is always an issue with that, but I found it was really kind of grounding to have a school-like, more formalized education in addition to all of this field learning that I was doing. So that's one thing. If you're able to do that, there are tons of resources online. There are tons of things on the GHC internal website that talk about online resources for learning. But definitely take advantage of that if you can. It's a really great way to kind of keep your active learning going.
And just to piggyback onto the active learning, I think one of the things that's cool is that it's a fellowship. It's not global health jobs. And I know, seriously, and you can talk with your supervisor about setting time aside for professional development and self-learning. And I think my co-fellow and I were in a pretty unique situation being in Boston and having a lot of different educational resources physically at our disposal. We went to a monitoring and evaluation course at Harvard School of Public Health, sat in on sort of logic model building in terms of how do you evaluate and define success within a clinical setting. We had a couple of brown bag lunch or sort of dinner events. And I think to your point about what do you get out of the talks from this past couple of weeks, one of the biggest things that I got was a sense of empowerment that you can ask these people to come sit down and talk with you. And a lot of the people that we spoke with were people who presented in these past 2 weeks. And we had a little bit of a smaller, maybe like 8 to 10 person sit down in which they spoke in more depth and more personally about some of the work that they had done. And kind of having the Global Health Core name empowered us to be able to do that and to like put out that ask. Another concrete thing that my co-fellow and I did was actually with the Global Health Delivery Project, there's a 3-week summer intensive, and we were like, this looks awesome. It's like a case-based learning, 3 graduate level credits. We were really excited about it. We were like, do you think this would fly? And we ended up kind of pitching it, and we were able to get our projects done in time to start that in the last 3 weeks of our fellowship placement. So it didn't necessarily inform the development of a project throughout our fellowship, but everyone was so unbelievably supportive of us kind of continuing that type of education. And the last thing, and this is a little bit of a personal pitch, if you are interested in online courses, I work partially with a platform called edX, which is run by Harvard and MIT, and we offer a lot of free online courses. I'm actually putting one together starting on September 15th in global health quality.
And she's doing a test run of it tomorrow as one of her sessions.
It's not as like skill-based, it's more sort of like conversation starting, but there are other like much more concrete skill-based courses if you want to know how to kind of sign up, get involved, stuff like that.
So, first of all, I wanted to thank all of you guys, everyone, if we could give them an awesome round of applause.